In Ethiopia's Tigray region, nearly 2 years of civil war have seen vaccination rates plummet. That, according to doctors and regional health officials, is causing a rise in deadly diseases. The number of children protected against illnesses such as measles, tetanus and whooping cough has fallen from over 90% in 2020 to below 10% this year, data from the Tigray Health Bureau shows. And that's undoing years of government efforts to boost immunisation rates. In a letter this month to the Global Vaccine Alliance Gavi, the Health Bureau said the hopes of children in the region to grow healthier and happier were snatched away in the blink of an eye. The letter said there have been measles outbreaks in 10 of Tigray's 35 districts since the war began. It also reported 25 cases of neonatal tetanus this year, compared to just 2 in each of the previous 3 years. The letter, seen by Reuters, blamed a decline in vaccination on supply shortages caused by what it called a siege of Tigray by Ethiopian federal forces, power outages that have disrupted vaccine cold chains, and the inability of people in rural areas to reach health facilities. A ceasefire between March and late August between Tigrayan and federal forces had allowed a trickle of medical aid into the region. But humanitarian access has been suspended since fighting resumed, a UN Commission of Human Rights experts said on Monday. In a report, the experts said they had reasonable grounds to believe that the denial of access to healthcare and other aid by federal authorities amounts to a crime against humanity. Spokespeople for Ethiopia's government, military and Prime Minister did not immediately respond to a request for comment on the UN report. Ethiopia's Health Minister, Tetanus, said vaccines had been provided to Tigray this year and that more were ready to be delivered when conditions allowed. She said in a statement that 860,000 measles shots were delivered in December last year and additional doses in April. Leah added that another planned delivery was on hold at the instruction of the UN's World Food Programme, which coordinates humanitarian relief in Tigray. However, WFP spokesperson Claire Neville said the agency was awaiting clearances from the Ethiopian government.